Joining us now is Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, good morning. It's great to have you with us on this Sunday. We have a lot to dive into here. I want to start with this. President-elect Biden says that he will release nearly all available vaccine doses as soon as he's sworn in, rather than hold back millions to make sure that the second doses are available. Is this a wise decision? And given the delays that we've seen so far, isn't there a risk that some people may not get their second doses in time?
Hey, good morning, Whit. Thanks for having me on. I think it's the right move. I think it's the right move for a variety of reasons. We've got to start getting these vaccines out to states. Part of the reason distribution has been slow is states don't know when they're going to get their vaccine orders. And I think in general, most people, probably all people, should be able to get their second dose exactly on time. And the reason is that we're going to have production systems that are going to keep up. So there is a balancing act here, but given the time we're in, I think this is the right move.
Speaking of some of the bottlenecking at the state level, a number of health officials, including FDA Commissioner Dr. Hahn, are now encouraging states to expand vaccinations to people over the age of 65. Now, some states, like New York, for example, expanded the age to 75 and older, but Governor Cuomo says that it could take up to 14 weeks before others can have access. So if you're 74, 73 years old, you have to wait until mid-April. Is that good enough?
No, it's not anywhere near good enough. Look, we're in the middle of a horrible surge. That variant that was mentioned is probably in every state or most states in the country. We've got to get people vaccinated quickly. And I actually think everybody over 55, certainly starting with people over 75, but working our way down quickly is the right approach. We've got to protect older people during this surge. Waiting until April just doesn't work.
We're already seeing some states make adjustments to those phases in the rollout there. A number of cases, we've been talking about the hospitalizations, the deaths. It's just been devastating in the surge. We've seen the post-holiday surge. Some estimate that we haven't even seen the peak of that holiday surge yet. In California, people have been stuck in ambulances parked outside hospitals for hours because there's no room in some of the ICUs. What do you expect to see in the coming weeks?
Yeah, so we're starting to see the effect of the holiday surge now in terms of infections but we're not yet seeing it in hospitalizations and deaths. We crossed 3,000 deaths a day consistently this past week. Those are deaths from infections in mid-December. So I am very worried about what's going to happen to hospitals and deaths in the weeks to come. That's why we're in such a tough time. We've got to get people vaccinated, and we've got to keep people wearing masks and social distancing.
Extremely important in these months to come. Dr. Jha, thank you so much for your time. We appreciate it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.